Welcome back to Beyond Well. I'm Sheila Hamilton, and we're continuing the what we're calling closet conversations because everybody's quarantining at home. But I'm so delighted to bring onto the show today Cindy Peterson-Dana. She's the Vice President for Peer and Recovery Support Services at MHA of Westchester, and she's worked in the mental health field in the United States, in St. Louis, Boston, and primarily in the New York City area as a clinician, an advocate, and in management. I think it's interesting, Cindy, that there is so much of your work that's right in the epicenter of the COVID environment. So talk to me about what your day-to-day life has been like.
Sure. Well, first, Sheila, I just want to say how honored I am to be part of today's podcast and to be part of this conversation. I admire you. I admire Mad in America. I really, value this opportunity to be part of a dialogue. I guess none of us picked where we were when this hit. And so what I've realized as I've talked to people across the country, family, friends, colleagues, and around the world is we are the epicenter in the U.S., although I think it's starting to ease up. We've been hit on all levels. And I think we actually went into lockdown mid-March. My agency, which is very diverse, we have clinics, housing, employment, recovery services, peer services. We moved about 90% virtual. So it's been a challenge. I think especially for essential workers that are still going in every day, some of the clinic staff, some of the housing staff, cleaning staff. And we also have a food pantry that we actually transitioned to a mobile food pantry. But each one of these steps has been much more complicated and kind of forced us to be much more thoughtful and move slowly. And also kind of left us all, I think, a little bit disoriented. And, initially, I think there was fewer concerns and fewer difficult moments reported to us from participants and staff. But as this has continued week after week, month after month, I think was still a lot of uncertainty. We're starting to see some, hard times. And I think that applies. I'll speak for myself. I've had kind of some ups and downs that I haven't had in recent years through this period. And we're all spending a lot of time kind of talking about how we're coping, and also how we're kind of being surprised by how traumatizing this has been.
Yeah.
We've lost a lot of people. I would say people in congregate care facilities have been hit the hardest. That includes residential facilities, hospitals. We also do some work in the Westchester Correctional Institution. They've lost people. So any place where people can't social distance and are already vulnerable in many ways have been hit the hardest.
Wow. I was just reading about your background in terms of how you found out about the open dialogue approach in 2010, and you've worked to integrate this kind of shared vision and these practices of mutual peer support. And if anything has really come clear to me is that the framework for open dialogue is so necessary for any kind of healing. But boy, talk about a useful set of tools for right now, navigating through this particularly difficult and unknown time that we're going through. Are you seeing the tenets of open dialogue as helpful right now?
Yes, there's some silver linings and there's a lot of uncertainty. I think, with all the virtual kind of meetings, we've actually been able to be in touch with people locally, the participants we serve, the families. But we've also found across the country, around the world, that we're in touch with other leaders, that are trying to bring dialogic work into practice. And I think that is sustaining us. It's not the same as being, in the same room with somebody, in the same country with somebody, but it is definitely reminding us that there can be value in, I think, the virtual world.
I want to know more about the process of becoming an open dialogue trainer. Can you speak about some of the key experiences that you had?
Sure. First, I just want to share that I have worked in this field since the mid-'80s. I'm a therapist and, as you mentioned, have done a variety of things. But I also, prior to that, had my own lived experience when I was a teenager of being hospitalized a couple times for mental health issues. And I remember at the time just really being hopeful that, wow, I'm going to the hospital, I'm going to get help. And then as soon as I got there, being very confused, hearing the psychiatrist tell my parents, your daughter has a brain disease, a chemical imbalance, she will be ill for life, she will need ECT, she will need this, and will need that. And nobody asked me, Cindy, what do you think is going on? Or what are your ideas about coming here today? From that moment on, I think, I got interested in the field. I decided I wanted to go to work in the field and really, found my way, but continued to, as I worked in the field, find, I think, even more of a disconnect from what my experience had been as a participant, as a client, as a peer survivor, and the way the system practiced. So I found my way to the survivor movement, the peer movement, and I actually came out of the closet about 10 years later. So, it's been a long process for me, and I consider myself, I don't like all these labels, but survivor, peer, professional. And then I'm also a family member. I have 4 young adult kids, and about 6 years ago, one of my sons had an extreme experience that I think typically would have been defined as psychosis and landed him very quickly in the hospital. We were able to use a dialogic approach and actually get through it in a much more supportive way, I think, for all of us. And he's doing well. I would say he got through college, stayed on track, has used prescribed drugs for very short periods of time when he feels that he needs them. That itself was probably my greatest teacher about how
I just
this
want to
approach...
pause and say how beautiful that is, Cindy. Like if other parents out there are hearing this and have the kind of like, oh, I wish I'd been able to do that, just to know that even if you can't save yourself, if you still have to go through a system that really isn't that advanced or progressive, that maybe you can do this for others around you, and you absolutely did that. That is it's so beautiful.
Thank you. I guess what really struck me, a few things struck me, both when I was going through it as a mother, I started to question. I was familiar with open dialogue, and I started to question, is this even going to work? It seems so simple, and we're going to get together and talk and have the help of family therapists and psychiatrists who's familiar with the model, but it seemed not what I had built it up to be in my mind when I had studied the theory and learned about it, 5 years earlier. And then the other thing is, I've been part of this movement since the 80s, survivors and alternatives and, clinical work. And here I am in New York City, and I could not find the services that we needed. I mean, when you need services, you need them very quickly sometimes. Even though Parachute was happening at the time, we are not eligible for Parachute. We live just outside of New York City border. It was a real challenge to pull something together. And I think that is what continues to motivate me to really try to create these type of services within the mainstream system. That can be challenging at times for many reasons. But I can really just feel that there's a real gap in what people need, especially at kind of the moments of greatest need.
I'm just so struck by, how much need is out there right now. It just kind of overwhelmed me just now, the enormous suffering that's going on. And if people aren't suffering from COVID directly and kind of involved in acute care, they're doing a different kind of suffering, which is wondering about their financial future and their spiritual future. And it's a lot to take in. It's a lot to take in. I want to know.
I think we're all going through that trauma on top of everything else we were going through before this started. And I do predict there will be a lot of kind of consequences to that in the months and years ahead.
I want to just know about when you're attempting to try to, especially in these times, educate people about peer-supported open dialogue, and you're trying to talk to them about changing a paradigm when everybody's stuck in a fear mode and a fear reaction cycle. How are you getting people beyond this sort of amygdala response to something that's higher level thinking to start implementing these new points of view?
I mean, that's a great question. And I think it fits both now, but it's really fit throughout the decades of my work, and, trying to find alternatives and create alternatives. I think you just have to find moments where there might be opening for creativity, for need, for something different. So in that way, I think we do have a big opening right now. I also feel a sense of pressure, because I think during difficult times, often we kind of revert back to the familiar. And so those of us that have been in touch from around the world on these Zoom calls are really talking about this. How can we, bring these dialogic ways of working with individuals and their social networks and families that are going through so much kind of into practice to really relieve the suffering that's happening and the suffering that may happen, in the future as a result of all the trauma.
This has to be my last question, but I'm very curious, Cindy, if, right now I'm seeing like a 20% increase in antidepressant use, 15% increase in antipsychotic use, 30% increase in sleep medications. And in so many ways, the overuse and especially when people begin layering on medication becomes even more problematic. Are you also seeing that same thing with the group of people you're serving? And do you have any thoughts about what you're advising your clients to do with regards to taking medication to get through this really tough time?
I'm not a psychiatrist, so I can't give medical advice. I do hope that we're having a dialogue about what we're doing, among the people that are providing these services, but especially among people that are coming for services, anybody they feel close to and connected to, because I find there's so much more to a situation than just what we call symptoms, or whatever the reaction is to the situation that's happening. So prescribed drugs certainly can reduce the difficulties of those momentary reactions and symptoms. I think it's critical that we start and keep a dialogue going about what led to those issues and also what can help us through. I'm just reading a book right now. It's okay that you're not okay.
Yeah, it's a great book. I've read it.
Yeah, and our culture pathologizes pain, and it often looks to the individual as the source of the problem. Just like when I was hospitalized back when I was 17, when there was so much happening in my life and in my relationships that never got talked about. And years later, as I did talk about it, that's what led me to recovery and to really understanding what had happened. And in some ways, I was never sick at all. I was reacting to things, and it was kind of layer upon layer of things. So
and you were likely a sensitive and intelligent human being who was having a real reaction and maybe a modified, dramatically heightened reaction to something that really needed to be reacted to.
I have to say, among the survivor peer world, there's a lot of what's called, Sasha DeBrule refers to it as dangerous gifts. I think there is a lot of sensitivity and intuition that, when left misunderstood, can really come out with great distress and end up getting labeled as an illness. And it's such an opportunity, if we can sit with it and talk about it, understand it, to move through it, beyond it. My best thought is the path through is dialogic, and it really happens at all levels. And I think it's easy to get polarized these days, politically, whether it's between, the medical model and the more humanistic dialogic approaches, the peer approach. I believe there is a real need and also a common ground, but we're not going to find that if we can't create a place for polyphony. That's part of the dialogic practice, is really hearing everybody's voice and expecting that there's going to be disagreement, almost really pulling and exploring the disagreement. If you sense tension, you kind of go into that and get curious about it, because there's often a lot of wisdom in that tension. And that also leads to next steps and a path forward, not in a, we're going to solve the problem for the next 10 years, but for today. As a group, we have a plan.
Yeah. And also just the physical process of opening and listening is so much better on the human psyche than defending and making sure you're right, So I love that. Cindy, if people want to find out more about your work, where do they go? What are the best places to find you?
We have a website, MHA of Westchester. Also, 845-709-7201. And I'll also give out my email address, Cindy Peterson-Dana @gmail.com. People can reach me if they have any follow-up questions. There's a lot of good things happening. We actually have this approach started at MHA, and again, we're providing it virtually at the moment. And we're doing what's called peer-supported open dialogue, which actually is an attempt to really balance the voice of professionals who have had their own lived experience and use that in their work with the more clinical approach. We kind of think there's value in a lot of different ways of looking at a situation, but we're guests. At the end of the day, we're guests to people's lives and to their families' lives. And so we really come in with humility and curiosity, and hopefully together find one step at a time a way through what's happening. And it works. I mean, it's amazing how the need for all these, coercive and much more difficult and expensive services go way down once you really just engage in a process that people feel heard.
Cindy Peterson-Dana, thank you again so much. And we want to thank the Foundation for Excellence in Mental Health Care for the support of this program. If you want to learn more, just click below.